Hi, this is a short video talking about increased renal values in our veterinary patients. So the two renal values that we tend to focus on primarily are urea and creatinine. So if you have an increase in your urea, we call that uremia. If you have an increase in your creatinine, we call that azotemia. And when we find that our patient is azotemic, we need to think of the origin. So where is that azotemia coming from? And there's three different categories that we need to consider: pre-renal, renal, and post-renal. So what they mean, pre-renal is anything before the kidney, so anything that could be causing a hypoperfusion to the kidneys themselves. So if we have a hypoperfusion, so a lack of perfusion to the kidneys, then the renal values and the toxins are not reaching the kidneys and therefore can't be excreted as efficiently as they should be able to. And this could be things like dehydration. If we're dehydrated, we're not perfusing our kidneys and therefore aren't delivering those toxins and those byproducts to the kidney for them to excrete. Maybe the patient's in hypovolemic shock, or maybe the patient's in congestive heart failure and the heart is not pumping effectively enough to deliver the blood to the kidneys. And typically this is quite easy to resolve by treating the underlying condition and improving the perfusion to the kidneys. And then secondly, we have renal disease. So this is anything where the disease is originating from the kidney itself. So maybe you have a chronic kidney disease or an acute kidney injury or something like glomerulonephritis, which is quite common. And this just means that the actual origin is within the kidney, and that's why they are failing to excrete those renal values or those renal toxins, and then therefore they're starting to build up in the bloodstream. And then thirdly, we have post-renal. So as it says on the tin, that's anything after the kidney. So this could be something like a urinary tract obstruction. Think of your blocked cats or your dogs that come in with stones. Maybe the patient had an RTA and we have a tear in the urethra. So anything after the kidney that is stopping those enzymes from being excreted effectively and stopping that flow of urine out of the body will lead to an increase in our kidney values.